Hello, welcome back to Astrology Study Group. And today we are going to pick up with our further study of astrological, medical astrology, how do I say it? Medical astrology or astrological outlay of the signs. It's starting to zone in a little bit on where we have excess heat. And last week we covered Saturn, excess cold in the body. So you should see this picture of the zodiacal man or just a man. Actually, this isn't the zodiacal one, but um, there's a lot of references which show the way the planets, I'm sorry, the signs roll out in the human body. So you can see here Aries is at the top, and then if you go look at going in order of the signs, then we have Taurus, which would be the neck, Gemini, like the shoulders and lungs. And I'm not going to go through all this because it's the area. We've covered this, but you can see how they're pointing to the general area. There's a lot in this area. Judith Hill, one of our favorite authors on this. Also Eileen Newman, Diane Kramer, all have a lot of good material in this. I think, I don't know, they all do in their own way. So anyway, this is just a picture I wanted to give you. Let me give you a new one. Here's the zodiacal man. This came out, in the early 1900s, George Carey. And what is it? The Zodiac and the Salts of Salvation, I believe is what it's called. And here we've got the man, going around. You can see each area where it would fall into the chart, into each area. And that they're going to cross over a little bit. Like we're showing Aries as first house, and they sort of have similar, but yet they each have their own distinctions, which we're kind of going over. But I just want to give you something to look at while we start talking about this. So remember last time we talked about Saturn in the chart, wherever it is where there's coldness, constriction, it's it's their opposite of Mars. Let's see if I can show you this. Like it's not going to be kind. All right. So anyway, I thought I'd give you a good definition, but it's not in front of me. All right. Anyway, Saturn, restriction, slow down, stagnation, crystallization, mineral deposits where minerals crystallize out. Mars now is going to be where things are heated up, where there'll be more fever, heat, inflammation, just as a rule. Okay, so with that being said, I'm going to kind of go back and forth with a little bit of Judith Hill's stuff. And actually, I'm going to give you something else to look at too. Let's give you this one. Okay, so we've got some, this way you can follow along, but there is some more. So I'll be filling in some of this for you as we go. So again, if you have your chart, your natal chart, get it out. If you don't know it, you can just look up in the ephemeris the day you were born. We don't need to know the houses right now. We don't need to know the time or anything like that. We just need to know what sign it's in. And for the most part, you can just look in the ephemeris and get this. So we're going to go through in order, just kind of like making it easy. So Mars in Aries, and you remember, the Aries is on the top of the head. So this placement may produce pains in the head, rupture of blood vessels, stroke, extreme restless, cuts, blows, wounds, or surgery to the head, cerebral congestion, tendency toward headaches. And I'm going to read on a little bit more of some other cross references here for you. So Aries, Mars and Aries would also be this. Well, no, this is a transit. Actually, I'm going to save this one, but let me just read you this. So you have things, we have two ways. You have it natally, where it is in your chart, but then we have it by transit as well. Actually, I'm going to save those. I'm going to save the transit. We'll go through those another time. All right, so let's just go through a little bit more with Mars. Dry hair, dry eyes, conjunctivitis. Remember, itis is inflammation of, all right, So our Mars is part of the comes under our eyes, comes out of the rulership there of Aries. All right, wounds to the head or eyeballs, capillary bleeding, heat stroke, rosacea, nosebleeds, fevers, acne. Oh yeah, any kind of wounds to the head. So yeah, definitely you can see acne, rosacea, the redness, more of it inflamed in and around the head area. All right, going on to Mars and Taurus. Mars and Taurus may create a hyperthyroid condition, laryngitis, enlarged tonsils, tonsillitis, polyps in the throat, adenoid problems, and inflammation of the nasal passages. Enlarged adenoids or tonsils, dry coughing spells. See, we have Mars because it heats up and it's not moistening, so that's why you have dry. And then the coughing would relate to the Taurus in the throat. Okay, sore throats or an enlarged thyroid. And just about everybody these days has a thyroid deficiency. We are just not getting iodine, and they stop putting iodine in salt. So the thyroid enlarges because it can't get enough iodine. It's trying to get bigger so it can have more of it, so it can filter, get it whatever it can out of the blood. All right, so enlarged thyroids. People with Jupiter and Taurus also tend to overeat. Okay, that was a little side note there. What else? Mars and Taurus. Sore throat, strep throat, or anything that's got any kind of inflamed part of that throat. Injuries to the ear, nose, throat, neck, thrush, herpes of the mouth, wounds to the neck, atlas axis, at the top of the skull, right where that joins into the head, the spine joins to the head. All right, moving on to Mars and Gemini. So as you remember, thinking Gemini, you should be thinking like bronchial lungs, arms, shoulders. So we would have nervous system, cuts and fractures and wounds to the arms or hands, collarbone. Not only the collarbone, I would also say the whole shoulder. Well, the shoulder is in this area. So if you have a shoulder, then you've got the whole rotator cuff area, the way the shoulder, that smooth area rolls around in there. You could have degeneration of that area. And you got, I've got rotator cuff. It's like you've got degenerated rotator cuff. You got a whole symptom. They get the bones in there, you got the muscles in there that have atrophied. And another big one is the slipped bicipital tendon. There's the bicep, you all know what the bicep muscle is. And there's a tendon, if you follow it, at the end of the muscle, it goes all the way up to the top of the top of the humerus there, just in that, and it goes into, there's a little groove that it goes through and it attaches onto it, and that flips out of there, and it can cause a lot of pain. All right, so I would say a lot of times shoulder problems, and shoulder is a big vitamin C area, and that would definitely indicate more for a Mars and Gemini. One other thing, what else I'm going to say about Mars and Gemini? Cuts. We said a little bit cuts to the hands, arms, nervous disorders, pneumonia, chronic bronchitis, coughing. Yeah. All right, Mars and Cancer. This may produce ulcers, right, in the stomach, or sensitive or touchy stomach. You have ulcers, which is inflamed, right? It's that hot, it's that ulcerated, sore, hot type of placement there. The walls of the stomach may be irritable or prone to inflammation. Let's see, chemical imbalances. Let's see. Here we go. Breast issues, because that's part of that upper part of the abdomen there. Gastritis. In the women in childbearing, or just not, irritated nipples. Poison oak, inflammation of the skin, poison ivy, poison oak, kind of that irritated type of itchy stuff, all itchy kind of stuff. Actually, anything, we get extreme itching would be a Mars. Actually, probably be a Mars and Gemini more than Cancer. All right, anyway, under Cancer, you'd have stomach ulcers, boils, inflammation of the mucous membranes. So you could have, what's like a GERD, what's the word I'm thinking of? Reflex esophagitis, Barrett syndrome, where that acid comes up in there, form into a little, creates an irritation. Inflammation of the mucous membranes. Well, definitely because of that whole upper part of the stomach where the esophagus comes down into the stomach is all a cancer ruled area. And if that's the very first part, when the stomach, when the food is coming down after it's chewed, in the mouth and the swallowed in the throat, Taurus, and then it goes down this tube, this travels a Gemini and into this hollow container. Hollow containers is also, that some people say that's a lot of cancer linings or things that are ruled under cancer, like hollow organs. So that's why the stomach is there. What else? I won't go into all of them so we don't confuse you at the moment. So what else I was going to say about I'm going in too many directions. The upper part of the stomach there, that's often where when you're under stress, it's what's called a hiatal hernia, where the top part of the stomach goes, that hiatal area goes up into the bottom part of the esophagus, because that gets spasmed under stress and it can't relax and allow the food to come down or to digest. That upper part of the stomach can get spasmed and then it doesn't digest. The food just sits there. So that's one problem with that area. So it could get, that food is there, and then if it's not combined right, or if you're upset, it's going to ferment instead of digest, and that's what will create more acids and inflammation of that area. Okay, that's where I wanted to go at. Okay, moving down. Mars in Leo. So we know this is kind of interesting because Cancer kind of comes down into the stomach, breasts area, and then the Leo area is more of the heart. So we got to kind of just differentiate a little bit. So we've got the heart, the arterial, the arterial part of the arterial system, the upper back, the spine muscles, the muscles on either side of the spine, and then we've got all the reflexes of all of the vertebrae. They each reflex, where the nerves come off of the spine, those go to certain anatomical parts. So all of those ones in the mid back are going to relate to Leo. So well, I won't go totally into it, but we've got the lower part of the digestion coming in from that area. So anything to do with heart palpitations, heart attacks, because that's an inflamed, the heart seizes up, aneurysms, hypertrophy, angina, pericarditis, endocarditis, sunstroke. Now, these are all inflamed parts of this, remember. Rheumatism in the back, scarlet and rheumatic fever is all kind of, that heating up. Also, inflammation of the spinal cord, back injuries, angina, wounds to the heart or back, high fevers, fevers that damage the spinal cord. Now that's kind of hard because we really don't get that hot, and the body has other ways of cooling it down. But I've not ever seen anything get that high personally. So let's go. Well, what else here? Inflammation of the heart. So you get a lot of these coming from, sometimes something is running lean and then it runs hot when it's not lubricated. Remember that. You get, remember, water dehydration, and then there's oil dehydration too. If you don't have enough good quality oils, then you can't keep the water in. So these systems would then tend to overheat. Something, like you're thinking of your muscular system, Mars rules muscles. So if you don't have enough ways to cool down, you'll overheat, you'll use up a lot of your minerals, you'll cramp. Okay, carry on. Mars going into Virgo. So we have that upper part of the digestive tract, inflammation of the, the spleen or the pancreas or the liver, dysentery, worms and bowel inflammation in general, gastroenteritis, peritonitis, cholera, a ventral hernia, typhoid and hyperinsulinism, all potential disease with Mars and Virgo. Also liver, when the liver is congested and heated up, it's too toxic. That's more of a heat related Virgo liver thing. Also diverticuli, diabetes due to the overgrowth or the overworking of the pancreas. Colitis, dry bowels because you don't have enough moisture. Remember, Virgo, we have some of the first part of that area, Virgo and Scorpio. Parasites, appendicitis. 16 to 19 degrees Virgo are related to the appendix. Oh, I like this one. Intestinal flu. Huh. Allergies due to hyperactive immune response. Insect bite reactions. Wounds to the abdomen. Okay, all Mars and Virgo. Now, coming around the last half of them, Mars and Libra. Mars and Libra relates to kidneys. We have the kidney inflammation, sudden flare-up or inflammation of the kidneys from a physical injury. Adrenal exhaustion, because the adrenals sit right on top of the kidneys, and then Mars is pushing that. Sex hormone imbalance, nephritis, pyelitis, acne due to hormones. So kind of sometimes you'll find 2 or 3 signs working together. Wounds to the lower back or kidneys. That's pretty straightforward. Mars and Scorpio. This placement may result in urinary disorders, cystitis, inguinal and scrotal hernias, hemorrhoids, venereal ulcers, particularly in the throat region, and pains in the bladder. Moreover, there may be problems with menstrual flow, ovaries, vaginitis, hypertrophy of the prostate gland. It gets swollen, and inflammation of the prostate. Now, I want to comment on that. Why would this prostate gland be, have this problem? A couple of reasons. One, the colon, especially the sigmoid colon, which is the lower part of the large bowel, large intestine, sigmoid colon, large intestine and colon are the same thing. But at the very end of it, right before it comes in, becomes the rectum and out the anus, that lower part kind of it curves around, and it curves around the prostate in the man and the uterus in the woman. And if that area is not healthy, if that tissue is broken down, if there's ulcerations, if there's like a leaky gut, and it's not hard for that to occur, then the toxins from the bowel will actually leak out into the surrounding tissue of that prostate or uterus and poison it directly. So that area reacts. It's like, ew, and it gets all inflamed and swollen. So a big part of reversing that, is to help the organ nearby. You take that pressure and that toxicity off the colon, then the prostate or uterus isn't going to be directly poisoned. So some of these things I have to just comment because it's they're more how would I say it, that it comes up more under a Mars type of condition. All right, Mars and Sag. Actually, is there anything else in here in Scorpio? Oh yeah, I know that's like pruritus. When you get that anal itching, when you get that, like it's an everyday thing. Or what is that called? Stepdaughter had that one time. It's like a cyst right on the end of your anus. I forget what pilonidal cyst. There we go. Thank you. Okay, worms of the colon and anus. Chronic diarrhea due to the throwing off toxins. Violent anal or genital itching. Wounds to the genitals. All right, Mars and Sag. With this configuration, sciatica, ulcers of the hips and thighs, injuries to the hips and thighs can take place. Let's just go on with that. Groin pulls. When you pull a groin muscle, sciatica, because we're talking about the area where the lumbar discs and the very lower part of the back come into the sacrum. It's like it can get wounded right in that area, in that little sacral joint, in that little spot on either side, and it can get really thin and painful, that lumbar sacral junction. And then if we move off to the side where the hip joins in, that whole area there can sometimes become unstable. And then it reflexes, to the thighs, to the hips, to that whole area. And the hip area, you want to remember, is vitamin E related. So we want to make sure that it's addressed. And then again, that's an oil soluble nutrient, which would help calm down inflammation. So we also have thigh muscles, hyperactivity, athletic injuries, wounds. The motor nerves can be agitated, again, because something is strained or pulled, and restricting or exacerbating the blood flow and the nerve impingement, kind of like what would be happening. And then you'd have, pain, or then like numbness coming down the legs. So you could have that whole syndrome of weakness and or numbness and or lack of function, but because something is pinched. So it's kind of interesting. It can kind of create it's not so much like a fever like other parts of Mars things, but it creates something over and under at the same time, is what I'm saying. So because we'd have something pinched, you might have lack of mobility because you can't walk because there's too much pain. All right, let's move on. Mars and Capricorn. With this placement, there may be bruises in and around the knee joints, knee injuries, and or inflammation of the gallbladder. I think this is the biggest one here for me. But knees, let's carry on with this here. Stability. And then a lot of the adrenal muscles, the gracilis and sartorius, tie into or insert into different parts of the knee. So you kind of inadvertently would have some adrenal issues here, especially if you've got, if Mars was involved. Also diseases of the hot or dry quality, rashes, itching, redness, heat, psoriasis, dry skin, boils, scars, keloids, all that kind of Mars and Capricorn. But I wanted to mention about the gallbladder a little bit, because when that bile gets thick, bile lubricates the colon, it helps emulsify fats, and the bile is made in the liver and it's just stored in the gallbladder, little storage tank there. And it should be liquidy and thin. But when it's not, when we get too much heat, say, it's going to dry it out. And the bile, or gall, it was called gall a long time ago. It could, so it's a bile bladder, basically. It gets thick, and then it can't go out the little door, the little duct. It gets thick, and then it forms little stones, and then big stones. And that's, we have a Capricorn problem here. So that would be, the heating of that, drying it out, because it's got to be thin and liquidy, and it's not. It's going to get thick and sludgy, and then keeps going and getting thick. Then we got the stones precipitating out, and then they get lodged in the duct, and then it gets painful and large and swollen and inflamed. Ta-da! See, there we go with Mars. So sometimes, things are in this various stages of dis-ease. There we go. Dis-ease. I don't want to say it's a disease, it's dis-ease, because it could you could be dehydrated for a while, and that whole area can be just sluggish, but then it can go from bad to worse really quickly. That can go that bile can get really thick and form a stone, and then want to squirt out. Maybe you eat something with a lot of fat, then the body's trying to squirt out the bile to digest it, and now you got a stone blocking that duct, and you're going to get massive pain. Well, some of the best things I found to do about that was, malic acid in apple cider vinegar relaxes that sphincter. That's one of the first things that I've reached for with people with problems. In that, there's a great little recipe with apple cider vinegar and apple juice, mixing them together and then just sipping on that, and to relax that valve, that little sphincter that's all tightened up. And then magnesium, taking a lot of magnesium, especially forms that you can absorb better, like magnesium glycinate, will also help to relax that sphincter and allow that stone to like move or to soften. And then you have to start working on softening up and thinning that bile. Okay, but anyway, I just thought I'd mention that because so many people have that problem, and it's just a godsend if you get the right information. Okay, Mars in Aquarius. Mars in Aquarius can indicate overheated blood, intermittent fevers, blood poisoning of the legs, back problems from heavy physical exercise. And what do I want to say more about this here? Sprained ankles, blood poisoning, wounds to the lower legs. All right, so probably affects the heart through the reflex action of Leo. Okay, this is kind of an interesting one because Aquarius, is not only it's the arterials, it's the running of the blood, it's it's fresh the blood, and then as it circulates through all the body parts, then it comes back as venous blood and into the liver to get reoxygenated. So I'm sorry, it goes back to the heart. Lost my train of thought. So we've got the big blood moving through the body, and then as it gets, how do I say it? I want to make this easy to understand. And so the Aquarius part of that is, I guess I would say the movement of it. Like we have Leo would be more the heart contracting, the valves opening and closing and pushing the blood, oxygenated and non-oxygenated and moving all that in a pump fashion. But then we have the apparatus that it moves through. There we go. That's the way I want you to see it. So all of the veins and arteries and veins that have to move the blood to, the oxygenated blood out, and then the unoxygenated blood back and forth. That's the Aquarian part, because Aquarius is, is that outward. It's going out and it's coming back. It's getting all of that. So overheated blood. Okay, so that would be the Mars thing. And then, so if you've got hotter blood, well, what do I really mean hotter? It could be, hotter. Your metabolism could be raised, and then that's going out into the body. So you're radiating more heat, that's going out more. And then the blood, if it's toxic, it's, it has more poisons moving through it. So it's going to heat up, the body's going to heat up. So those would then exacerbate the Mars and Aquarius types of problems. That one's is not as easier as what's the word I want? It's not as poignant as some of the other ones. Okay, coming around, the last one, Mars and Pisces. Mars and Pisces may produce hyperinsulinism and other sugar ailments. There may also be injuries to the feet, broken bones, cuts, and sweating feet. Excessive drinking, like alcoholism, and very weak vitality are also possible. In addition, there may be acute lymphatic conditions and early childhood ailments, including sudden fevers, colds, and flu on a continual basis. So it's kind of like the exacerbation of immune dysfunction. Here we go. Restless feet syndrome, hot feet, foot injuries, lymphatic infection, mumps, duodenal ulcers, hypersexuality, substance abuse, bloodborne diseases, poison oak, blisters, boils, blood parasites, waterborne diseases, bleeding or difficult clotting, foul body odor due to metabolic disorders. Those are all Mars and Pisces types of symptoms or reactions. Okay, now what else did I want to talk about? Let's go get another picture here. Let's look at this again. All right, so if we're looking at, again, Mars and Saturn, we want to just get an idea of where it's at. And is it a hot sign? Is it a feminine sign, or is it a masculine sign? Is it above the horizon, or is it below the horizon? So there's a couple things that would make something better or worse. If something, remember, is above the horizon, it's going to be more exacerbated. So if you have, how do I say it? Let me say it this way. If you have Saturn, which is cold, and it's above the horizon, that means it would be out during the day. That would be like in houses 7 through 12. That would be above on the top of the chart. So if Saturn is there, it's going to be have a tendency to heat up more because the sun, it's out with the sun, and it will warm the somewhat cold Saturn. And if it's in a masculine sign, starting with Aries, Gemini, Leo, Libra, Sagittarius, Aquarius, that will also make it a little warmer. It will offset some of its cold tendencies. And then Mars is the other way around. If it's above the horizon, it's going to exacerbate its hot tendencies. And if it's in masculine signs, it's going to exacerbate that as well. It's going to make it hotter. So if you have a lot of other planets or things that tend to be heat producing, then that's going to make it more, that type of Mars in that placement will make it more exaggerated. If it's in a feminine sign, it will cool it down. If Mars is underneath the horizon, it will cool it down. So it depends on what other excesses or deficiencies you have in your chart. But just to know that if it's again above, it's going to strengthen. It'll be more of a day, planet. If it's below that, it'll be a night planet, and it's going to be less. It'll be colder, no matter which one it is. All right. Also look at what element it's in. Is the let's just talk about Mars for now. Is it in a is it in a fire sign? Is it in a water sign? Is it in an earth sign? Is it in an air sign? Those will all have some more tendencies toward certain disease pathology. Is it in its rulership? Is it in its stability? You want to check and see the placement. Is it strong? Is it strongly placed, or is it weakly placed in your chart? So if it's in its fall, or if it's in its detriment, and it's say Mars, just because we're talking about Mars today, say Mars, its home is in Aries. So let's just say it's in opposite, it's in Libra. And then let's say it's also down in the bottom of your chart in the fourth house. Well, it's going to be colder placement there. If it's in Aries in the upper part of the chart, it's going to be a hotter placement for Mars. I'll go ahead and tell you this one other part, and then we'll get into this one another time. Once you know the rulership, like say Mars is in Aries, right? That's where it would be at its home. It can also reflect to other signs. So I'm just going to use Mars and Aries as a example. So like, just say your Mars is here in Aries, and we're looking at the first house. You could whatever is opposite of your Mars. This is not just Aries. I'm just using it as an example. It will also reflect to the sign opposite, and then to the signs at the 90 degrees, which would be all the cardinal signs, and then to the signs that is in conjunct. So you could really have it reflecting into, not only the sign that's in, it would be 1, 2, 3, 4, 5 different signs that you can kind of follow pathology with something in the system. It gets a little tricky, but once you kind of know a couple of the rules, it's easy to find out. All right, so recapping Mars, look in your chart to see where it is. What sign is it in, to give you the area of where you might overheat in your part of the body. Again, if it's in Aries, you're going to look for things, eyes, upper teeth, nose, head. I've got Mars in Aries, and I get hot. I just get hot. My metabolism runs hot. Of course, I like hot, spicy things, which makes it worse. So I also I wear glasses. I wear contact lenses. I have since I was young. There's eye problems there. I'm just trying to give you some other things off the top of my head. I have scars on my head. I was burned. Yeah. So, you'll find things there whenever I get fatigued, my eyes are burned, yada, yada. So you look in your chart to see where that is, and then look to see if it's in its rulership, if it's in dignity, or if it's in its fall or detriment, that would weaken it, or nothing, right? And then also look and see if it's aspecting things nicely or not nicely. If you've got squares and oppositions and inconjuncts, a bunch of things to it, then it's going to challenge it a little bit more. Or what if it's just a singleton? What if it's there by itself? It's not integrated. So maybe there'll be some disconnection from maybe some part of your body that should be getting heat and isn't. So these are the little things that we look at, and we'll go through a few more of this. We'll look at also iron this out a little bit more. Then we'll look at charts in a week or two. We'll look at go see in the charts and apply some of this that we're looking at. But just to get some of this down, it's important to just impress in the part of the body. And right now we're heating and cooling. That's kind of the easiest way to just get this across. And I really like something simple like this, Zodiac man, because we can, again, you can see the part of the body that's, reflexed. But if you get the books of Judith Hill, like I really like her, Medical Astrology, A Guide to Planetary Pathology, and what's the other one? Medical Astrology in Action, the Transits of Health. Now that one is fascinating. When we get to there, we'll go through what happens. And this is what I think is really good to know is in transits, because you know what you're born with, but then, it's not always that way. It's like I said, I have Mars in Aries, but like I'm not always hot. I'm not always overheated. My eyes, I don't always have that kind of stuff. But when certain things come around, like whenever Mars is in Aries, every 2 years, that's just going to make that worse for me. So I have to make sure that I, have peppermint tea in the house, that I plenty of ice, that I don't do too much spicy food. I, make sure I drink enough water. I'm taking my oils. I get my cod liver oil, things to cool myself down. So you're looking for then the transit that would exacerbate the condition in the natal chart. Also, like if you have a Saturn condition, where is it cold? And when something is going to transit your Saturn by, either conjuncting it or by opposition, it's going to ping on it, and it's going to make it go one way or the other. And it's going to exacerbate whatever it is in your chart. And then if again you think about what planet is tickling on the other one, what if you have Saturn on Saturn? It's going to maybe be cold on cold. What if you have Mars on Saturn aspect coming up? Well, then you might have something heating up something cold. All right, so give you some things to think about. Start out just wide, don't get overwhelmed, but just go look in your chart, see what areas of the body could tend to be hot and cold, and then look at the shape of that planet. Again, is it all by itself? Is there other planets aspecting it, offsetting things, making it worse? And then just kind of give it a general assessment. And just because, again, you may have something that looks horrible, it's just an indication of telling you what a potential problem is. If you've got bald tires and, you're going down the mountain and you didn't know, somebody pointing that out, you might drive very differently knowing that if you didn't know, right? So knowing some of these things, you can definitely affect the condition by knowing. Totally. One more thing. So if you have something that is like heavy in fire, like just, we're talking about Mars today, you've got a lot of other things indicating fire or exemplifying Mars. That's just showing you the weak link in the chain, or where you need to pay attention to something, or where it's most likely to go out of balance. It doesn't mean, just because we read something that says aneurysm, or brain bleeding or something, that you're going to have that because of that symptom. Those are just some of the areas where something extreme could occur. And again, because it may be in a certain area, you head it off at the pass. You don't just, I've got Mars and Aries, I'm going to have an aneurysm. It's like, well, pay attention. Pay attention to your blood, pay attention to your diet, pay attention to, your those conditions, obviously. But I just thought I'd say it. All right. that concludes today. We'll carry on. I think this is definitely fascinating. I hope you do. And we'll go from there. All right. Have a good time looking at your chart where you're hot and cold, where we all run hot and cold. All right. Talk to you next time. Let's see, I want to go over here. Do, 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 do.